Simple Guide to Antidepressants. Antidepressants generally act to increase particular neurotransmitters in the brain. These are usually serotonin, but they can also increase noradrenaline and also a few other chemicals that they actually act on. Depending on their actions then, they tend to have different adverse effects. So serotonergic drugs tend to cause nausea, diarrhea, and sexual dysfunction. Drugs increasing noradrenergic effects tend to cause sweating, orthostatic hypotension, and increased blood pressure. And generally, they all tend to cause some neurological adverse effects, such as dizziness, sedation, and agitation. Usually, they take some time to work, which can be 1 to 2 weeks or more. So generally, you tend to get the adverse effects before any beneficial effects. Let's take it up a level. The most commonly used antidepressants are the ones called the selective serotonin reuptake inhibitors, or SSRIs. These inhibit the reuptake of serotonin. Essentially, what they then do is to increase serotonin concentrations in the synapse between two nerve cells, and this then is thought to result in improved mood and help with anxiety. You can also have serotonin and noradrenaline reuptake inhibitors, or SNRIs. These have a similar effect to the SSRIs, but also inhibit noradrenaline reuptake and increase noradrenaline levels in the same synapses. They result in more adverse effects, but also tend to have higher efficacy. You also get tricyclic antidepressants. These are old traditional antidepressants, and they tend to have the effect of inhibiting the reuptake of serotonin and noradrenaline, but they also then act on many other receptors and neurotransmitters in the brain, and as a result tend to cause more adverse effects. And there's a range of other options on the market now. For example, agomelatine acts on serotonin and the melatonin receptor, and mirtazapine acts on serotonin and histamine receptors. And both histamine and melatonin are related to sleep, so these agents might be beneficial for patients who are struggling with sleep.